I'll bring up our slides here, and just the way that it kind of fits into our ecosystem. Like a lot of our customers and councils know us for our demographic information. So that's our rich history of 30 years providing demographic insights at geographies that are useful for council decision making. And as we kind of started rolling that out 30 years ago, we started to learn about some of the other needs that councils had. So we decided pretty quickly on that the demographic information was really helpful to tell us, well, who lives in a place now and how has that changed over time? But it doesn't really tell us much about the future. So our team elected to create a population forecast. So we've got kind of 3 different products here that look at the history, the current and historical demographics of a place and the most likely future. We also have an annually updated economic data set that some of you would subscribe to, a housing monitor, and the part of the business that I joined, which is the community views service. So if all of these other data sets are empirical or objective or modeled data about places, the community views gives you kind of a lived experience. So what are the community's perspectives on these topics? I guess in practice, that means that if we provide, say, Wangaratta Shire with the demographic information, and through the demographic information, we learn about comorbidities and kind of the health incidence of health issues in the community. We model out the age structure for Wangaratta to understand the likely future demand for health services. If we then understand the healthcare and social assistance share of economy and the kind of the jobs in the community that are attributed to the healthcare and social assistance, we can also then understand how the community feels about their health and well-being, how they feel about their ability to access health services. So it just kind of provides a nice, well-rounded understanding of community of topics to inform your council planning, your health and wellbeing planning, and particularly your advocacy initiatives, which I know is important at this time of year. So specifically community views, even though it is a survey-based approach, it's probably different to a lot of other surveys that councils receive. So historically, we know that councils, particularly in Victoria, they run a satisfaction survey. So to do with these services that you provide. So it's kind of at that end of the continuum. So how do you feel about access to the pool, the parks and gardens, the libraries, and those kind of things? Our approach to surveying is really about, well, what can we learn about the community, their values and their priorities to influence the direction of the strategic plans, the council plans, the health and wellbeing initiatives, the economic development strategies, the housing plans, the health, the community safety plans. So we decided that we would kind of craft a series of questions that would be most helpful for those kind of topics, to really allow decision makers to create policies that are resident-centric. So if the community says they place a high value on access to nature and they believe that a local area is delivering well for that, that would probably form some pillar of a health and wellbeing plan or some pillar of a council plan. And that would then give you the ability to say, well, we've got a measure for how our community feels about nature, and that allows us to monitor that over time. So we're really focusing on the things that are of value to our community. We also recognise, though, however, that councils, particularly in rural areas, kind of looking at it at a council level is helpful, but it's not particularly instructive. You need to be able to go and look at the individual villages, towns, precincts. I can imagine Hepburn Shire, you might have some similarities between Daylesford and Hepburn Springs, but you might also have some unique kind of differences. Each of those towns might have resident compositions or particular needs that are a bit more acute than the other. So our approach is really also designed on being able to generate large and independent samples of the community that look and feel like your population. And then also with the community views service, it's about ensuring that if we're going to provide these insights, that they're actually useful. We don't want to be the kind of organisation that just writes a report, sends it to you, and then it sits on the shelf. And if Emma leaves Massive Ranges and goes and works somewhere else, Emma's the new Emma doesn't necessarily know how to pick that up because it hasn't kind of been broadly communicated. So we provide the data online, we connect it to your policy and your advocacy initiatives, and kind of so it gets kind of a corporate use across the organisation. And since launching the Community Views service in 2021, we've been really fortunate to work with a large and diverse group of councils, and we cover kind of these range of topics. And every time we work with a council, we actually give the council the ability to ask custom questions as well. But central to our offer and central to ID is being able to understand a local area, but in the context of a broader area. And understanding the context of a broader area brings us to what we're going to talk about today. So each year, Informed Decisions funds what we call the Living in Australia survey. So we go out there, we survey a demographically and spatially representative sample of the community, and we ask them all of our core questions that we present to an individual council. So it principally provides us with a view of what life is like in Australia at a point in time, the ability to drill down to kind of some local areas, but also to monitor change over time, but really to provide benchmarking. So when we are commissioned by Huon Valley Council in Tasmania, when we are commissioned by the City of Port Phillip in Melbourne, we can look at their community's views and priorities in the context of Greater Melbourne, in the context of Victoria, in the context of Australia. So you can really understand what's unique and what's consistent about your place. Now, we commit to updating that every year, and we make these findings available. So anything I'm showing you today is publicly available. You receive links to it afterwards. We've also written a report here, the Living in Australia report. You can actually access that online as well if you want to kind of go through it in a bit more detail. So as part of that today, though, the focus will be on, we're talking a bit about Australia generally, but then we'll zoom in specifically on the 632 rural and regional Victorians who completed the survey. The survey was conducted in May of last year and published in September of last year. We're going to lead by talking about overall livability. Livability is a really subjective concept. There are lots of lists out there that talk about overall livability. What a lot of them fail to do particularly well, though, is understand that different people in different places will have different kind of perspectives on what they believe contributes towards making somewhere a good place to live, and how they experience those things where they live. So our approach is really bottom up. So what we do is we take these 16 attributes, and I created these in 2014 when I was working somewhere else. And these attributes are they were created because they were largely present across government policy documents, but they were also known to empirically advance quality of life. So if you do have access to affordable housing, you will have a high quality of life. If you do feel connected to your community, you will have a high quality of life. So we kind of created them in that way as well. So in practice, our approach to understanding livability, we present the people who complete the survey with those 16 attributes, and we ask them to tell us the 5 that they believe contribute most towards making somewhere a good place to live. So through that, we get a kind of a hierarchy of values for a community. Values do change place to place, and you'll see examples of that in a moment. We then represent the list of 16 attributes to the survey participants and ask them to tell us, based on their local area, how do they feel their local area is performing for feeling safe, for high quality health services, for the provision of reliable and efficient public transport. And you just get to score that between 0 and 10. So we just learn what's going well and what's not going so well in a place. We derive the overall livability, though, by multiplying the community's values by their lived experiences and then calculating it out to a score out of 100. So you can imagine if a community places a very high value on feeling safe and they do feel safe in their local area, that will push the score closer to 100 because the thing that's of high value to me is going really well. And so therefore that's great. But the opposite, of course, is also true. So if the residents place a really high value on access to high quality health services, but they don't believe their local area is delivering in that regard, that will then push the index down a little bit lower. So you can imagine all these 16 attributes kind of working together to create one number. That one number, it's nice because it's one number. It's attractive to look at one number. A lot of councils we work with use that overall livability index as a way to monitor progress against their long-term vision, but it's not at all instructive. What's instructive is being able to get underneath that and figure out, well, which of these attributes are most important to our community, where we think we can make a positive change in local area experiences over the long term. That's what we call the community priorities, and I'm going to focus on some of those priorities today with a bit of a lens on regional and rural Victorians' perspectives. So from an Australian perspective, in 2029, when we look at the relationship between the community's values and their lived experiences, we get an overall livability index of 59.5 out of 100. Oops, sorry for the typo there. For those keen numerate people, it should say 59.5, not 59.4. I'll own that mistake, the decimal place. So while this tells us that overall livability is below 60, it does tell us that, well, it's not super low, it's not super high. So there must be some things that are going well and maybe some things that aren't going so well that need to be focused on. And when we look just at a kind of really blunt, broad analysis of regional Australia versus metropolitan Australia, we do see a bit of a difference and a bit of a gap. So metropolitan Australians, the things that they value are a little bit more positively experienced than regional and rural Australians in the collective. But again, looking at those two groups in such a blunt way is perhaps a little bit, it doesn't really give us kind of anything to really work with because there's such large geographies and there's so many different versions of regional and metropolitan Australia. If we break that down to look at the 16 attributes themselves, so what we're looking at on the right here is an export from the views reporting and exploratory platform. The things that the Australians place the greatest value on are feeling safe. 65% of people nominated among their top 5, followed by affordable, decent housing, access to the natural environment, high quality health services, public transport, making your way to and from services, and good job prospects. So those are the things that the residents place the most value on. And then if you look over here at the experiences, you see a bit of a mixed bag. So when we ask people how safe they feel in their local area, the average Australian said 6.2 out of 10. When we ask about affordable, decent housing, they say 4.5 out of 10. When we ask about nature, 7.6 out of 10, and high quality health services, 6.1 out of 10. So again, looking at it from an Australian level, you kind of blunt out all of the nuance, but this just gives you a sense of what's happening in Australia at the time. What I will want to draw your attention to are these kind of items we call the core 4. So feeling safe, affordable, decent housing, access to nature, and high quality health services. Those are the 4 attributes. It doesn't really matter where we do this survey, be it at a national level, be it out in East Gippsland, be it in Southeast Queensland. These 4 are always kind of among kind of the top handful. We do see some other differences though. So while I won't show it on any charts today, inner city communities with quite culturally diverse resident cohorts that are in densely populated areas will place a much higher value on social cohesion than people who live in regional and rural areas. Regional and rural Australians will place a much higher value on a strong sense of community than people who live in inner city areas. So there are some things that play out a little bit differently. People think fast growing outer suburban areas, particularly on the urban fringes, they'll place a high value on a lack of road congestion because their local area experiences of road congestion are getting worse and worse and worse. So you do see some of that nuance play out, but these core 4, I think I'm going to talk about today, and we really want to make sure you draw your attention to. This is a different way of looking at that list. So this is a matrix we have available, and you can access this later today because we have it available on the Views Reporting and Exploratory platform, where over on the right-hand side, you can see the attributes. So those that are further to the right are of higher importance to Australians. Those that peer closer to the top are more positively experienced. And you can see, again, these core 4, they really do stand alone as the things that are most important and most influential. And what we'd like to see from an Australian perspective over time is if we can help people feel a little bit safer, if they can go from 6.2 to a 6.6 out of 10 on average, because it's so important to us, that will put upward pressure on the overall livability index. Affordable, decent housing. Look, there's 2 ways of looking at affordable, decent housing from a national perspective. One is you can say, well, it's the second most important item and it's the 16th most positively experienced, so we're kind of like in a helpless state. However, if you look at it the other way and say, well, it's actually a really significant opportunity if we can find a way to crack the code on creating more affordable, decent housing for Australians, and we can migrate that really kind of low score of, I think it was 4.5 out of 10, to a 5.5 out of 10, or even a 6 out of 10 over 15 or 20 years, that will put upward pressure on overall livability. So it's actually a massive opportunity to advance Australians' quality of life. High quality health services and access to nature. High quality health services deeply tied to demographic characteristics. I'm going to speak a lot about that later on in the presentation. And access to nature, again, it's a fundamental core tenet of being an Australian, is being able to access nature. It's something that is really important to Australians and is very positively experienced. But what about regional and rural Victorians? So there's 632 regional and rural Victorians who completed our survey. When we look at their values and their local area experiences, and I've just got the top few here, we've got feeling safe is the most important thing, followed by access to nature, followed by high quality health services, and followed by affordable, decent housing, and then a strong sense of community. And then we look over on the right-hand side and we look at experiences, 6.5 out of 10 for feeling safe, 8.1 out of 10 for access to nature, 5.5 for high quality health services, and 4.8 out of 10 for affordable, decent housing. What I've done here now is I've overlaid the national averages on the dots. So this tells us that feeling safe is kind of a bit of a mixed bag. So it's really important to regional and rural Victorians. It's about as important to regional and rural Victorians as it is to the average Australian. The local area experiences of feeling safe are a little bit better in regional and rural Victoria than they are across Australia in average. But I will show you over the next couple of slides that things have actually been getting worse in this topic. So I've put a little bit of a cross against it. The things that are going really well, the things that I think are unique features of regional and rural Victoria, things to celebrate and things to extend, things that you can use to attract people to live, work and invest in regional and rural Victoria. Your residents' access to nature. Bradley's lovely walking trail behind him there is a great example of that. And a strong sense of community. I think that and I'll speak about the relationship between these two things using data in a moment, but you all know as regional and rural Victorians that these two things work well together. If you just look at this, the significantly higher value that the average regional and rural Australian places on a strong sense of community, 40% saying it's among the most important things, compared to 29% across Australia, which means a lot less in metropolitan areas. Regional rural Victorians rating their local area 6.5 out of 10 for a strong sense of community. That's pretty good. It's better than the average Australian, but it could be better. Like imagine if we could get that to a 7 out of 10, people feeling connected to each other, which is a challenge in an environment where we're aging, maybe some young people are leaving, maybe some football, netball clubs that used to be kind of the things that stuck the town together are no longer viable because of the lack of young people. So there's certainly a challenge there, but that's also an opportunity. And the two things that are really challenging regional and rural Victoria's livability: access to high quality health services. I'll speak about this. This is a regional and rural Australian issue. It's an aging issue. It's a mental health issue, but it's expressing itself here in these numbers in regional and rural Victoria, and affordable decent housing. So when we bring all those things together, we end up with an overall livability index for regional and rural Victoria of 59.7, which when we compare it to the 2024 livability index of 65, it's a significant decline. I'm going to speak about that decline now. Feeling safe. So feeling safe, for those of you who have like suffered through a year 10 psychology class, you probably learned about the Maslow's hierarchy of needs. Safety and shelter and health and all those kind of things. We speak about it as a foundational element. So if you've got these core 4 things that always come up, feeling safe is the most important thing. It doesn't really matter where we do this survey. Feeling safe is almost always going to come out on top as the most important attribute that contributes towards making somewhere a good place to live. And from a regional and rural perspective, this is certainly the case. What we learned here in looking at regional and rural Victorians is that yes, we spoke before about how the experiences are a little bit better than the average Australian, but by and large, we see that Western Victorians rated their local area a little bit better than Central Victorians and Eastern Victorians, but it's kind of there or thereabouts. Southern New South Wales residents rated their local area 7.4 out of 10 for feeling safe. Greater Melburnian residents rated their local area 5.9 out of 10 for feeling safe. A significant decline. I'll speak to that on the next slide. But you can just see here that even though everyone pretty much places a high value on it, the experiences can be completely different based on where people live, and even in finer geographies, they can be completely different where people live. So you take a place like, I don't know, Greater Shepparton, for example, you might have a completely different perspective on feeling safe in Murchison as you do in Mooroopna. And those places aren't too far apart from each other. And the recourse required to help people feel safer will be very place specific. So I've already mentioned that overall livability across the country has gone down over the last couple of years. And this is the relationship between overall livability and the importance of feeling safe and experiences of feeling safe across regional and rural Victoria. So 2023 and 2024, we had pretty decent experiences. Sorry, we had pretty high levels of overall livability across regional and rural Victoria, 64.7 and 65. And then we came back down to 59.7 in 2025. And what's really driving that decline is a reduced perception of safety in and around regional and rural Victorians' local areas. So in 2023, people rated their local area 7.3 out of 10. We went down to 6.9 and we're now at 6.5. If you look at Greater Melbourne, you've got pretty much the same dynamic occurring, although the perceptions of safety have declined even more. So here we've got an overall livability index in Greater Melbourne that was 65, now down to 61. We've got a relative stability in how important feeling safe is, but significant declines in local area perceptions of safety. Where we've done some analysis looking at the relationship between perceptions of safety in place and crime stats, you'd be unsurprised to see that where we see an increase in crimes against the person, where the victims are selected at random, even though the probability of me being carjacked, of my home being invaded, is still incredibly low. If there is a material increase in the presence of those sorts of crimes, if there's a sharing of those sorts of crimes with Ring cameras and social media, it makes it feel like it's everywhere. It makes it feel like it's unstoppable. And so that's actually affecting people's perception of safety, for better or for worse. We do know that if people don't feel safe, it will ultimately affect their behaviour. If you don't feel safe where you live, you're less likely to participate, you're less likely to go outside, you're less likely to be healthy, you're less likely to have incidental contact with people, you're less likely to participate in a nighttime economy. And so for us, people can talk about media beat-ups and all this kind of stuff, but the reality is that people don't feel safe in Greater Melbourne. They feel less safe than they did in regional and rural Victoria. And that has consequences to behaviour, that has consequences for community development, that has consequences for economic development. What we want to be able to do, though, when we're talking about feeling safe, is take a nuanced approach. So feeling safe, all I've spoken about to this point is crime, law and order, justice. What we really want to be able to do is try and seek some agency in improving perceptions of safety. And when we do this work for councils, we speak to them about there's different kind of lenses you can take to feeling safe. A lens you can take to feeling safe is a law and order response. And when we've worked with the City of Canning in metropolitan Perth, they have explored the idea of feeling safe. They've used the data to go and have a conversation with the state government about getting some additional investment in CCTV, getting some additional investment in local community policing, because they were able to demonstrate that that they were at a disadvantage compared to the Greater Perth average. So that's how you can use it from an advocacy perspective. But we know councils do a lot of work around community development and community building and sports and recreation investment to create a sense of community. We do see a really strong relationship between how connected people feel to each other and how safe they feel in place. So this chart here shows that when people tell us they have a low sense of community in their local area, when regional and rural Victorians tell us that, they also tell us that they don't feel safe in their local area. So if I rate my sense of community between 0 and 3 out of 10 in Camperdown, then I'm going to rate I'm most likely going to rate my perceptions of safety low as well. But you can see that just the contrast here and the upward lift you get on if we have a strong sense of community, if we feel connected to each other, if we invest in those connections, we will feel safer. And if we feel safer, we'll be healthier, we'll participate. So when councils are seeking agency for this, for their community development strategies, for their council plans, for their health and wellbeing plans, and we talk about feeling safe, they often direct the investment towards those community development initiatives, towards the parks and gardens, towards the arts and culture, those kind of things that bring people together. When we ask people specifically, well, what ideas do you have to advance quality of life? And we kind of zoom in on the perceptions of safety. We have a language model I'll be able to show you later on if we've got the time, that actually kind of brings the comments together in a meaningful way. We do see that the average regional and rural Victorian has quite a nuanced view on what can be done to help people feel safer, probably through 3 lenses. The first is obviously the law and order response, strict bail, all those kind of things. The second is a public health response. So there's a lot of actual empathy, particularly for younger people. So a lot of it's quite nice to read actually a lot of older regional and rural Victorians reflecting on some of the challenges facing young people and why they maybe don't feel like a sense of connection to each other, or don't feel like they've got a strong future, and so therefore they're participating in these kind of crimes. So drug and alcohol abuse is the third one. So there's kind of a critical observation of drug and alcohol abuse being quite pervasive across the community. So those are kind of the 3 things that people are saying we'd like to see. But I will say from a regional and rural Victorian perspective, yes, feeling safe is really important to your community. Yes, experiences have got a little bit worse, but there is a resilience there. So it's not as bad in regional and rural Victoria as it is in a lot of other places across Australia. The declines haven't been as steep in regional and rural Victoria as they were in Greater Melbourne. So there is a resilience there, and that resilience around community safety, I think, is strongly connected to the strong sense of community that regional and rural Victorians have. So that's another argument for continue to invest in those community development initiatives, because it will help with that kind of sense of cohesion and help build that resilience of safety, build that resilience around local area livability. The second topic I want to talk to today is about access to nature. So we know that Australians' identities is really closely tied to natural landscapes. We know that through our Indigenous history. We know that through our modern history. We are deeply connected to place. We are deeply vulnerable to place as well. And I'm sure as regional and rural Victorians, you all know, you've all probably experienced some of those vulnerabilities as it relates to bushfire, flood, and those sort of drought and those sort of things. Our economy, particularly in regional and rural areas, is deeply connected to place. And our economy is evolving through energy transition as well, which is a big challenge for regional and rural Victorians, and I'll speak to that in a minute. Regional and rural Victorians rate their local area an average of 8.1 out of 10, a great outcome compared to the average Australian of 7.6 out of 10. And we talked to our council partners about this, and I'm just kind of reflecting on some work I did on the Sunshine Coast recently. We survey residents on the Sunshine Coast every year for this topic. We position it as being, it's something to celebrate. This thing that your community places a high value on is going really well. So you've got to celebrate that. But because the community places a high value on it and it's being largely positively experienced, you've also got to focus on protecting it. Because if the residents themselves start to see that their ability to access nature, either through industrialisation, either through overdevelopment, either through poor decision making, if that starts to become affected because they place such a high value on it, they'll be very sensitive to any changes. A walking track that used to exist that doesn't exist anymore. A car park that I used to be able to get a car park at that I can't get a car park at anymore. The presence of rubbish where there wasn't rubbish before. All these little things can add up and start to affect how the community feels about their ability to access nature. And so it's a two-pronged thing. Celebrate nature, but be really conscious that that the residents themselves will be really focused on their ability to access nature if in the face of development, be it industrialisation and be it population growth. From a regional and rural Victorian perspective, Eastern Victorians reported really positive local area experiences, as did Central Victorians, as did Western Victorians. So really great outcomes across the board there for regional and rural Victorians. Again, just looking at another relationship piece here, the relationship between access to nature and mental health, that's meant to say, not social well-being. Sorry about that. I changed that this morning. I didn't change the headline. Is not as strong as the relationship between sense of community and perceptions of safety, but it certainly is still present. So what this data tells us is that when regional and rural Victorians feel like they have poor access to nature, they're also likely to tell us that they're in worse mental health. Again, probably not surprising, but another example as to why we need to invest in nature. And similarly, when they do have good access to nature, when they're participating in nature, they report really positive mental health. I'm going to speak about high quality health services in a moment. So again, if you can't build a hospital, you can probably seek funding for a hospital. You can probably seek funding for a mental health clinic and some outpatient services, but you can continue to invest in nature, because investing in nature is good for the economy. It's good for residents. It's good for residents' health. That's something just to call out there. But again, something to celebrate. From a regional and rural Victorian perspective, it's the second most important thing. It's the first most positively experienced. You know, what an outcome. The thing that we place a value on is going super well. That's not just a regional and rural Victorian dynamic, mind you. A lot of regional and rural Australian areas have that same dynamic. It's really important to us, and it's going quite well. I'm just going to switch gears a little bit to talk about an adjacency to do with nature, which is climate change. So one of the other sets of questions we ask on our Living in Australia survey, and we ask for our council customers, is a tranche of questions about climate change, belief in climate change, how climate change is affecting residents in their local area, and mitigation strategies, or what recourse they would like council to take with regards to climate change. Climate change is actually quite a divisive topic still, and perhaps expressed in regional and rural Victorian communities in such a way? Well, we do look just at belief structures around climate change. We do see at a really blunt level again, metropolitan Australians have stronger belief in climate change than regional and rural Australians do. But the difference, even though it's significant here because the statistical test shows it's significant, it's really not that different. So 9 out of every 10 people you walk past in the street around Australia will say, oh yeah, I believe in climate change. What is different though, and where I think there's a lot of nuance, it's pretty simple nuance, but nuance that needs to be understood, is how people construct their belief around climate change. So when we do this work in inner city areas, inner city residents have a completely different belief structure around what's forming climate change to people who live in less densely populated areas. So this little table here shows us that when we surveyed inner city people, 94% of them believe in climate change. 60% of them believe it's caused by humans, mostly or entirely caused by humans. The further you go from those densely populated areas, the more diverse people's belief structure around climate change becomes. So when we survey people from smaller communities, these are LGAs with less than 15,000 residents in them. So you can imagine they're kind of quite smaller communities across regional and rural Australia. You've got 30% of people saying it's caused entirely by humans. You've got another third saying, well, it's probably a bit of both. And you've got 25% of people saying, well, it's nature, I'm not sure. Like, I'm just not sure it's happening, but I'm just not sure. So this is something that I'm when we've worked with regional and rural communities on their health and wellbeing plans, on their council plans, and the topic of climate change comes up, it's incredibly divisive because the belief structures in a community are very, very different and need to be understood at the local area level. The further out you go from metropolitan and densely populated areas, also the higher the increase in people who say, I don't believe it, it's not real. But again, that's still a really small proportion of the community. It's important to note, though, that as we're looking at this spatially, there are some demographic characteristics that play into it too. So generally speaking, much older people will still believe in climate change, but have a kind of a stronger belief that it's probably just part of natural cycles. We kind of go up and down, and that's just the way it is. Whereas the younger you are, the more densely populated area you are, the more acute your belief that it's caused entirely by humans. And I think these belief structures are important when we're thinking about what to do next. And so a lot of the comments we get from the community about nature are related to energy transition because they fear this loss of the thing that they place such a high value to them. They fear that they're losing their nature because the people in the city can't turn the lights off. They fear that the industrialization of the landscapes is going to change this thing that they hold so dear. So it becomes very, very, very divisive. And again, I haven't walked in your shoes as regional and rural councils and regional and rural representatives from councils, but I can imagine that a lot of the kind of communications you're having with the developers, with the community, with the other levels of government are around this tension to do with accessing to land, losing agricultural land. And it's a tension that is really quite profound in regional and rural Victorian communities. And some of the examples you can see here where people can actually hold those two beliefs. We need to do something about climate change, but maybe this isn't the way to do it. Maybe this isn't the place to do it, because what benefit am I getting? How is that affecting the improvements in the things that I really think we need to focus on? But it's just taking something away from me. It's taking away this agricultural land. It's taking away the landscape that I like to look at and have looked at for so long. It's putting upward pressure on housing prices. So there's lots of different kind of like consequences of the energy transition, but I do think it does anchor back to nature, particularly in regional and rural communities, because it is such a positively unique feature. The third and final thing I want to talk about today is high quality health services. Across regional and rural Victoria, 54% of the residents placed it as one of the things that contributes most towards making summer a good place to live. It was a little bit more important in 2025 compared to 2024, and they rated their local air experiences 5.5 out of 10. If we look over here, we can see that regional and rural Victorians reported poorer local air experiences for high quality health services compared to the average Australian. And if you look at these two columns here, you look at these major population areas, Greater Sydney, Southeast Queensland and Greater Melbourne. All the major tertiary hospitals, all the services and all the workforce are concentrated in the inner and middle suburban areas, a little bit in the outer suburban areas, but a lot more of the demand is in regional and rural areas, particularly in those Asian communities, particularly in communities with high levels of morbidity. And you see that over here on the right-hand side with the regional and rural Australians' views on high quality health services. Right at the very start of the presentation, I spoke about the overall livability index for regional and rural Australians being a little bit lower than metropolitan Australians. This is really what's driving that difference. People in regional and rural Australia place a bit more value on high quality health services. They report poorer local area experiences, and therefore the overall livability of these places is worse. A couple of things to call out here is there is quite a variety of experiences across Western Victoria, Central Victoria, and Eastern Victoria, and I'll call that out in a little bit, but you can see it present on the side here. We spoke about spatial differences before through the context of climate change. Now we're going to speak about spatial differences through the context of health services. Again, we've employed that analysis around where people live across the country and the value they place on high quality health services and their experience in place. This is a critically important national issue where the further you are from a densely populated area, the greater value you place on high quality health services and the poorer and poorer your local area experiences are. It's incredibly complex because as people get older, they're more likely to engage with the health system. Younger people might leave for opportunity. Younger people are the workforce for the healthcare and social assistance sector. So what can we do to attract them in? I'm of the view that regional and rural Victoria is probably better positioned than some other states because of how close a lot of our communities are to major metropolitan areas, Bendigo, Ballarat, Geelong, where I live, Warrnambool to a lesser extent, particularly those kind of places. Eastern Victoria is, there's some big concerns there around Eastern Victoria, particularly the far East Gippsland area where the median age is something like 52. They've got significant issues around accessing health services, but there is a level of resilience there for Central Victoria, for Western Victoria, but it certainly is something that's dynamic where we're seeing perceptions and experiences around health services increasingly better in metropolitan areas and increasingly worse in regional and rural communities. Just zooming in now on Eastern Victoria, Central Victoria, and Western Victoria. Again, the Eastern Victorians, they rate their health services 5 out of 10. Central Victorians and Western Victorians 5.9 and 5.8 out of 10. Greater Melbourne 6.6 out of 10. So there's clearly a gap there in Eastern Victoria, clearly a gap there in Greater Melbourne. You can't necessarily expect that the people of Sale, the people of Lakes Entrance, Meetung are going to give their score a 10 out of 10, but 5 out of 10 is probably not good enough. And so we need to look at places like Bairnsdale, Sale. Can those kind of places, Traralgon, can those kind of places do a bit more of the heavy lifting, not just in the tertiary services, but in the community health? There's a lot of calls for mental health clinics, a lot of calls for those kind of things, outpatient clinics, dialysis, those kind of things in Eastern Victoria, and we see that come through the comments here. Okay, so just to close now, 4 key takeaways. I just really want to call out that while we tend to focus on what needs to improve, there's a lot really good happening in regional and rural Victoria. And regional and rural Victorians, the best thing they have is a really clear set of values and a clear set of priorities. So it's like we have this kind of belief in safety, nature, health, and housing. We score our local areas this. Therefore, this is what you should focus on across all levels of government. They don't really care who's going to do it, but they know you need to focus on it. And we know that councils have a direct policy role, but an increasingly important advocacy role in that space as well. It's important also to mention that while those perceptions of safety have driven the decline in overall livability across regional and rural Victoria, there is a level of resilience that regional and rural Victorians have and an argument to continue investing in community development, to continue to investing in for safety and for health purposes. Just wanted to also remember to call out again that your regional and rural Victorians are unique compared to Melburnians in that you have this real direct connection to nature, deep connection to nature. It drives the well-being, it drives a lot of the economy, but there are a lot of concerns about what we could lose through energy transition. I'm sure you're living with that again. There is a massive tension. And then also to say that a multifaceted approach with regards to addressing health services is really crucial for regional and rural Victoria moving forward. And by multifaceted, we're talking, well, how do we attract speech pathologists and physiotherapists to choose to build a life in Warrnambool? How can we get them to move from Ringwood to Warrnambool? What attractor qualities do we have? they probably place a high value on nature. Can we use that to draw them in? But what about our social infrastructure? You know, if they're going to come, they're working age, they might have children. What are the schools like? Like, we need to look at it in a holistic sense too, particularly those areas where our age profile is becoming a little bit older. What role do we play? Are we a camper now, like you can see over here, where our age profile is probably going to get a little bit older, but we're close enough to Colac, we're close enough to Warrnambool, we're close enough to Geelong that we don't necessarily need it. We don't need a new hospital in Camperdown probably, but we probably do need some investment in Colac, probably do need some investment in Warrnambool, probably do need to continue to invest in the major population area of Geelong as well. So that's one thing I just wanted to make sure we called out. So I'll pause there for questions and reflections, and I'll do my best to answer them by showing you examples from our platform. Thank you for listening.